Um,
There's a bunch of people hopping on. Yay, good morning, everybody. I love that everyone is hopping on. This morning, we're gonna have Maile speaking. She is a wealth of knowledge, a beautiful mama who lives on Kauai. I'm hoping this summer, once all the weird COVID stuff stops, like we can meet in person when we go to visit some of our families. So I'm super stoked about that. Maile is gonna be speaking about essential oils for mom and baby. As most of you know, if you're following Thrive Postpartum, we really believe in holistic care, and essential oils are for sure a part of health and wellness, and definitely applies when you're a mom. They are like, need to be in your diaper bag, need to be in your purse, need to be all over your house. And it's a really fun thing to learn. So Maile is gonna take it from here. I hope that everyone's downloaded their note-taking guide, because you're gonna wanna take notes when she's speaking, for sure. So Maile, if you wanna take it away, it's all yours.
yeah, welcome. Good morning, everybody. I'm going to go ahead and share my screen, my slides with you. And I just want to start by giving you guys a little bit of background about who I am and kind of how I got to be sharing about essential oils and educating about essential oils, because I do this all over. I usually travel quite a bit, but right now I obviously haven't been. But I love being able to connect with people, and mostly moms all over. So thank you so much, Kirsten, for inviting me to present and to connect with all of you. When she first reached out, I was like, yes, my passion is connecting with other moms, and you know, my births were what got me even started into this. So my name is Maile Maii. You know, first and foremost, I'm a mama of 3 very spirited young girls. They are 8, well, she'll be 8 in next week, 6 and 3.5. And we were born and raised on Oahu, my family and I, and we moved to Kauai about 2 years ago, because this is where our family is, and we were wanting to raise our kids in a more rural area. So just a little background on us is, you know, we have, you know, I feel like I've lived so many lifetimes and adventures and all these things before coming a mama, and all of them contributed to the way that I mother, and the way that we're raising our kids to really be very independent. From, you know, went from sailing on Hokulea from Micronesia to Japan, and being a flight attendant and Hawaiian Airlines, and to working on feature films in the Bahamas, and all these different adventures. And the theme has always been woven through all of those experiences is a fierce sense of adventure and independence, and as a desire to have the ability to take care of myself in whatever environment I was in, wherever I was in the world. And so when my husband and I decided we were ready to start a family, we waited for quite a while. We waited for probably 5 years before we're like, okay, I think we're ready to do this. You know, when we decided that, we decided we want a home birth. We wanted a gentle birth. We wanted a natural birth. And so we reached out to a midwife that probably many of you guys know, Dr. Lori Kimata. So she delivered all 3 of our girls at home. And so both my husband and I are really strong advocates of home birth and of natural birth, because of, we both really benefit from the experience. I think bringing men into that conversation is really important, but we're not going to get into that today. But we've just both been very strong advocates of choice and of independence in our health. And so when my first daughter was about 3 months old, she got really congested, and you know, I did all the natural prenatal stuff, and I did the natural birth, and then she was sick, and I was like, okay, what can I actually use on this precious little being? I hadn't even prepared for that. I hadn't thought, like, oh, how do you care for them when something happens? Like, I did all the prep work, you know? And I was really at a loss. I wasn't going to go to Long's and put some chemicals on my baby And so I reached out to Dr. Lori, and she was like, okay, well, you need to get these oils, and you need to only use um, doTERRA is the only brand that you can use on your baby. And I was like, okay, I know nothing about oils, except that lavender is very calming and melaleuca is good for zits. That was like the extent of my knowledge. And so I just began this journey of learning. And we started with Breathe, which is one of my favorites with babies, but I'll get into that. Um, and she could breathe. She was 3 months old. We were supposed to be going on a trip. She was so congested in her tiny little nostrils, and she couldn't breathe. And all I wanted was for my baby to breathe. And so we found these oils, and they worked. She could breathe. And so we started to try other things, and everything that we tried worked. And then we're like, oh, let's try things for you, for my husband, and things for me, and everything seemed to work. And we're like, wow, this is amazing. And so I just dove right into it. Um, you know, like I said, my oldest is 8 now. She's never taken any meds. She's never taken baby Tylenol. She's never taken any cold meds, nothing. Like, she's just very, her immune system is robust. We've had our share of emergencies and crazy accidents and injuries and all those sort of things. And we've still been able to deal with them all naturally. So, like I said in the beginning, my passion is to share this with other moms, because I honestly don't know how to mom without essential oils, without natural solutions at my fingertips to help them with anything that comes along, as well as, like I said, that independence is so important for me. And raising young girls, I think, is a huge responsibility, that they know how to take care of themselves. And so that's something that we proactively teach in our home too, is for our kids to identify what's going on with them, and for them to reach out for the tools that they need, which they do all the time, every day. They're like, I think I need this. And I'm like, great, go get it, put it on. It also makes our lives easier when they do things for themselves, right? But I want to know that if something happens, they can take care of themselves. So I'm very, very passionate about sharing this. So thank you again to Kirsten and Danica for inviting me to participate in this summit. I always like to start with a little disclaimer. I am not a medical doctor, and information shared is based on my own reading, my own personal experience. I encourage everybody to do their own research, to explore this on your own, or alongside somebody like myself who is a wellness advocate who can help guide you. But please check with your medical provider or midwife before making any changes to your routine. And that at all times, I'm only speaking to the quality and efficacy of doTERRA essential oils. There are many, many brands, and they are not all the same. So I want to be clear that, like, when I'm telling you some of the protocols that we've used, I'm speaking only to this quality of essential oils. I don't want you to go to like Target or Ross's or Whole Foods and pick up some oils and be like, that's what she said to do. So just want to put that out there. So any recommendations that I am making today are about doTERRA essential oils. Okay. Yay, you just turned on your diffuser. So I want to talk, a bit about that. So why doTERRA? Why is that such a, why is this the only brand that I trust to use on myself and on my babies? And number one being the quality. There is no ratings. There's no laws when it comes to the labeling of essential oils. So you can go to Whole Foods and you can see oils that say 100% pure essential oil, and that doesn't have to be the case. They can write whatever they want on that label. So things that I want you to look for is things that say like not safe for topical use. That should be a red flag. There are no essential oils. doTERRA does not have a single oil that is not safe for topical use. If it's not safe for topical use, it is probably synthetic. So doTERRA actually created a rating system because there was no standard out there, and that's called CPTG, and that stands for Certified Pure Therapeutic Grade. So these oils aren't just, they're beyond food grade, they're actually medicinal grade. And that means that they're just completely pure and potent. It means that there's no foreign contaminants or fillers. And they're grown in a part of the world where they have the ideal natural chemistry. to perform the way medicinally that we want them to. You'll also notice that they are a lot more potent than oils that you'll find. I have a really good friend who was like, yeah, oh my gosh, I love oregano oil. I use it for everything. Whenever we're sick, I just take some in my mouth and it's so good. And I was like, okay, awesome. Again, in the beginning, when I had no experience with oils. And so I was like, yeah, do you want to try the doTERRA oregano? And she did. And she called me back and she was like, oh my gosh, that was so strong. I usually do like a whole, like half a spoonful of this oregano oil. And she's like, and one drop in my mouth was burning. And I was like, oh my gosh, I'm so sorry. She's like, no, that's amazing. It's so potent. I had no idea. And so they're completely different. Oftentimes like one drop of our peppermint oil is as strong as like drinking 28 cups of peppermint tea. It's that energizing and invigorating. And then safety, right? So for all of us, when we're looking at either maybe you're pregnant here, or maybe you have a newborn, or maybe you're planning to start the journey of getting pregnant, whatever that is, everything we do to our bodies is also affecting that baby. And even once they're born and stuff, I never cared about the safety of things. This sounds so bad to say, but I never really cared about the safety things until I became pregnant. And instantly I was like, oh, I better read the label on that. I better read the warning on that. What is in this insert in this? I used to take a migraine medicine and I stopped as soon as I found out I was pregnant, because up until then, I hadn't really cared about the side effects. Like, how bad is that, you guys? I just was like, it's okay. It takes care of the migraine. I can't function. So I'm just going to take it. But I didn't like the way that it made me feel, right? There's side effects. So one of the really great things about essential oils is that there are no side effects. They're just pure plants. And then they're affordable. So when I talk about essential oils, and again, like with doTERRA essential oils, they are so potent. So oftentimes a dose is one drop. Like for example, when we have an earache in our family, we'll use a drop of melaleuca and a drop of lavender, and we'll put it around the outside of the ear, never in the ear canal, but right around the outside, on the ridges, rub a little bit behind the ear, and it goes away. And that costs me about 30 to 50 cents. No doctor visit. I have a friend who lives here on Kauai, and they traveled to Oahu because their daughter's ear infection got so bad. And I was like, sister, you have oils. Like, I know you do. Like, I see them in your bathroom. They're so easy to use. And with one drop being a dose, they are so incredibly affordable. The migraine medicine that I used to take was about $40 each pill. And I could only get 12 of them with my copay. And they had side effects, and other issues that I didn't actually want to take. And now I use oils. I use, brie for the ear, melaleuca, and lavender. Sometimes basil. You can put in basil too if you have. Most people have melaleuca and lavender though. And now for migraines, I use a combination of frankincense and helichrysum and juniper berry. And those are some expensive oils when you look at the whole, when you look at by the bottle price. But by the drop price for one dose for me is under $1. And to take care of a migraine all naturally. I don't know if any of you guys on here get migraines, but there's nothing like it. You pretty much want like life to end. And to be able to take care of that naturally with no side effects has been such a gift to me. And then the other reason why it's very, very important to me to choose doTERRA is the sourcing. So I've been fortunate enough to go on a couple of sourcing trips. We have our sourcing model is called co-impact sourcing. If fair trade is something that is important to you, you'll want to Google that. It's co-impact sourcing. And this sourcing model makes sure that everybody along the supply chain is taken care of. I've gotten to go to Bulgaria and to Nepal and meet with farmers and harvesters, where we are working with small scale farmers all over the world to empower them to have their own businesses, and this also ensures the best quality because they pour their love into growing these plants, and they get paid more the better the quality is, because doTERRA ensures fair and on-time payments for them. We have a whole philanthropic arm called the Healing Hands Foundation, where we, in Nepal, we built safe water, clean water for them. In Bulgaria, we worked at orphanages. Another thing called the Milk Canteen, which is a really cool initiative that provides affordable meals for kids under 3. People pay like $1 and they go pick up breakfast, lunch, and dinner for their kids. It's heavily subsidized, but just very cool things like all over the world to help the communities that we partner with. And it also ensures that we're getting the highest quality because the people on the ground actually love and care about what they're doing. And for me, knowing that these are things that I'm putting on my children, I needed to know that people weren't being exploited along the way for me to get these things, right? And so when you look at the regular commercial essential oil market, it is the growers and the harvesters who are getting the least, because it's all middlemen who are picking up. They harvest in bulk, they distill the bulk, and then they take that oil and then they just rebottle it, all the different brands. Most companies, probably only 1 or 2 other companies, actually work with the growers and with the harvesters. So it makes a huge, huge difference. Yeah, this was for me the biggest one. My background is in nonprofit work. And so when I realized the sourcing model was something I could actually get behind, was actually when I began doing this as a business. I was an avid essential oil user and customer for about 2 years. And then I learned about the sourcing model and a lot of the different ways that this company empowers people, from everyone along the supply chain to our representatives. So that was the key piece for me, was the sourcing model. Okay, I want to get into how to actually use and apply oils. So the first way that we use them, and probably the way that most people are familiar with, is aromatic, like aromatherapy, right? And I just want to say, especially because, you know, this is for like babies, babies' sense of smell begins to develop before they're even born, which is so incredible. So their nostrils form actually in your first trimester, and their scent receptors form by the second trimester. So while they're in the womb and they are breathing in the amniotic fluid, it actually helps them to become familiar with your scent, and specifically their mother's scent, right? And so, you know, for me, one of my favorite things when my baby was newborn, one of my favorite things was that I could actually have this opportunity to imprint memories with her, right? And they, you know, they always say putting them on your chest. One of the things that you can do with that is rose oil. The scent of rose oil is very, it's connecting. So it really helps the baby to feel that connection with mama. And so we actually used a lot of rose on my chest, as well as on my husband's chest when he would, because he did a lot of the baby wearing as well. So we would just use that rose oil to really help them to feel connected with us. It's really great if you can rub some on before nursing. Anytime they're in your chest area is a really great time to use rose oil. Other ways that you can use oils aromatically, though, are in a diffuser if you have one. I also really love using them for like on a blanket or on a stuffed animal. So when our sense of scent affects our emotions and our entire like limbic system in as quick as 30 seconds. So sometimes just smelling something can really help shift the mood, either for yourself, if you're feeling overwhelmed, if you're feeling stressed, feeling angry, so many emotions running right now. Add on top of that being either postpartum or pregnant. There's just a lot of things going on right now. So sometimes all you need to do is take a second, you know, rub some oils in your hand and take a second and just take a deep inhale, and you'll feel your body calm down. And the thing is, this, you can do the same thing for your babies at any age. Aromatic usage is safe at any age. This is the first thing that I used when my daughter was sick. We actually did a little like bathroom hot box. I didn't have a diffuser. I had some oils. I did not have a diffuser, and I had a stuffy baby. And so we closed up the bathroom. I ran the hot shower, and filled the sink with water and put a few drops of Breathe and eucalyptus in there and just made a steam room. And it worked so well. So even if you don't have a diffuser, there's things you can do. You can simply rub some lavender on your hands and like hold it near their face. On myself, I will cup it over my nose and my mouth. On my little ones, I'll just hold it in front of their face so they can smell it. I also love, like I was saying, like a drop on their blankie, some calming oils on their blankie and tucking them in. These scents imprint. So these become memories that when they smell it, and you know how you have certain things that you smell and you're like, oh my gosh, this takes me back to my childhood. These are the things that you get a chance to do with your little ones and imprint these memories so that when they smell certain things, they're like, oh my gosh, my mom used to massage me with this, or I remember this smell from when I was a baby, right? We have a chance to imprint these special memories by layering on that sense of smell with it. So I just love that. There's some oils that I remember using with my first daughter, like it takes me back to specific memories. And I love that. So another thing you can do is sometimes when my kids are stuffed, congested, I will take like a drop of Breathe and put it on their stuffed animal and just kind of like tuck it in next to them so that they're getting that smell. When I was still using an Ergo, I would put some oils on it, some calming oils to just make them feel safe and calm, right? Anything we can do to make them feel safe is going to really, really help them overall. And then I also would do that in the car seat. I would spray that. So you could take something like lavender or Balance and put in a spray bottle with some water and you just shake it and you just mist it over the car seat. I had one that was like totally okay in the car seat, one that was like not really great in it, and one that did the whole like, pushing out, like you had to like get the arms in, like it just was so hard. And so I used that a lot with her, was spraying down the car seat, making it be this space that smelled familiar and that smelled like something she knew as a safe space that she liked. And I would do that, and that really helped a lot. Yeah, I don't know. I mean, I don't think I would like a car seat either. Your kids hated it too. I wouldn't like that, but we do what we have to do. Okay, so that's the first way we use aromatically, and that is the easiest way. And that's something, everybody can do. And the next one is topical. And again, this is for doTERRA oils. They're safe to use topically. And general dilution rate for babies is 1 to 3 drops in a 10 milliliter roller bottle. Now I use doTERRA's fractionated coconut oil. It's called a carrier oil. This is for diluting oils for safe topical use. And what that does is it also makes your oils go a lot farther. So fractionated coconut oil is just coconut oil that has been fractionated so that it stays liquid at room temperature. It's never gonna get solid. Like when it's cold, it won't ever get solid. It won't go rancid. It doesn't have any fragrance. So when you mix it with essential oils, it's not gonna change that smell. And then it's really great for mixing. So you can use it simply by just pouring some in your hand. My favorite thing to do with my babies, we didn't bathe any of them in water until they were over a month old. So we just did this. We gave them sort of like an anointing, if you will. I took the coconut oil, and because we were doing it every day for like a month, I would just take 1 bottle of this and I would add frankincense and lavender. Both really good for the skin, both really calming and grounding for them. And so I would just add that into here and I would just wipe them down completely. Like we didn't want to disturb their vernix. We just didn't do baths until after a month. So that was what we did. And so every day they got their massage with their lavender and their frankincense. And it's, we had no problems with their skin. Again, probably because of the essential oils and also because of their vernix remaining intact, but keeping that for them and not washing off their natural skin oils, but contributing it to them. Another thing about fractionated coconut oil is that it absorbs really quickly. So it's not like kitchen coconut oil or manoi when you go and lay out at the beach. It doesn't just sit there and stay on top of you. It actually soaks right in. And so it actually helps the essential oils to absorb. So yeah, that was one of my favorite things with babies is doing that daily massage. If they get really dirty, because some of mine were summer babies, and so they had a lot of like the milk in their rolls, and it starts to get a little funky. We would wipe them down with like a little washcloth in those areas and everything. But then we would do this. Danica said, I've heard that doesn't really matter the concentration of oils as much as how frequently you apply them, meaning 20 drops of lavender in 10 ml. Is it better than, yes, totally. The rule of thumb is less oils more often. I would rather you use like 1 to 3 drops in about a 10 ml size for babies. And then just, yeah, applying it more often. That's going to keep, so when you think of essential oils, think of them like almost like a food, because they are plants. They're all natural. So your body metabolizes them as it would a food. So you don't want to eat just like one giant meal a day and be like, okay, I should be good till tomorrow, right? You're going to eat every couple hours, maybe, especially for little ones, right? They're cycling through all of that faster. Yeah, definitely. That is the understanding. So yeah, that's the dilution rate. You can use other carrier oils like you can use avocado, jojoba, argan oil, all different ones. Just a lot of them are a lot more thicker and they don't absorb as well. So that is topical use. One thing that I like to do, especially for babies, if you're wondering if something is hot, test it. And this is especially for like teething blends and stuff, but test it right on this corner of your mouth, right? You know, when you get a little bit of hot sauce and you get it on that corner of your mouth and it really burns, that's a very sensitive spot. So I tested everything that I made first on myself before I would put it on my girls. And then topically too, some things we're going to use on the area of concern, right? If you have a rash or you have they hit their head or a cut or something like that, you're going to put, or a tummy ache, you're going to put it on that area of concern. But if you're wanting to just get overall systematic support, like immune support or something, you can use oils down their spine. Oftentimes it'll be in a roller. It makes it really easy to, it's already diluted in the amount that you need, and you just roll it right up their spine. Also on the bottoms of the feet. When you put on their spine, make sure to put on a shirt. If you are putting it on their feet, put on some socks so that they don't touch it and then touch their eyes. If you do ever have an issue with getting oils in the eyes or oils in a place that is sensitive and hurts, all you're going to do is take that carrier oil and dilute it further, and it'll take away the sting right away. I had my daughter, I don't know, she was maybe like 3, and she was playing with my peppermint bottle. There's a little bit of residue on the outside, and she touched it, and then she touched her eye. And as you can imagine, that did not feel good. And so we just took some coconut oil, I poured some in my hand, and I just like dabbed it and just kept wiping across her eye and just wiped some more across her eye. And it was done in about 15 seconds. So one thing to know about oils is, as we all know, oils and water don't mix. So if you get an oil in a place that does not feel good, you want to dilute it further with a carrier oil. If you add water to it, it's actually going to repel each other, and it's going to drive it deeper, and it'll hurt even more. So just to always want to have this on hand for safe use, even on adults, but definitely for babies. And then internal use. Now, this is something that, well, I will tell you, I did use them internally on my baby when she was really young, but this is mainly for mama. And there's a few different ways to use oils internally. Drinking them in your water. Oils that taste good. Citrus oils are really good for a natural detox. They help your metabolism. They help your energy. They help you drink more water because it makes your water taste better. So citrus oils are really, really great for that. There are some oils, though, that we want to take internally. Again, this is only doTERRA essential oils. When I'm talking about taking them internally, they're not just safe to take internally. They're actually intended to be taken internally. One way that you know this is when you look at the side of a bottle. Like, this is my frankincense. And so when I turn it, you can actually see here that there's supplement facts. I hope that's big enough for you guys. Supplement facts like you would see on a box of food, right? And that's how you know that this frankincense can be taken internally. It's labeled that way. Now, this is my adaptive, which I also love, but it doesn't have a food label on it, right? There's no supplement facts on this one. So you wouldn't take this internally. That's a really easy way to know if that particular essential oil is intended to be used internally or not. So frankincense is a great example. I don't take frankincense internally because of the flavor. It is not a flavor that I particularly enjoy, but I do want the health benefits from it. So something like that you can use in a veggie capsule. They are, they're little capsules that you can see that. And you just simply open them up and you can put your oils in there. Now, a really great example of an oil that you'd want to take internally and not necessarily taste is fennel. Fennel is incredible at increasing your milk supply. I nursed all my girls till a year, and when they go through growth spurts, right, and you haven't caught up yet and they want more, and so they're demanding more, it hurts. And sometimes you just need to kick up your milk supply, or maybe you had a little cold, or you haven't been getting enough sleep, or whatever it is that your milk supply isn't meeting their needs. Fennel is an incredible booster for your milk supply. It tastes like licorice though, and that's like not my favorite flavor. So I put it in a capsule. I take 2 to 3 drops in a capsule, like for 2 to 3 days until my milk supply bumps up. It's usually very, very fast, and then stop taking it. It's not something that you have to take every day. I know a lot of people take fennel tea as well. The oil is gonna be a lot more potent, and also you don't have to drink a whole cup of licorice. So that's one way that you take them internally for moms. Another thing I hear a lot from moms is headaches and stuff. And so another way to use oils is actually under the tongue. That's called sublingually. And it's just simply a drop under the tongue. My favorite one to use for that is copaiba. It's copaiba. It is good for so many things, but it's really great for reducing stress and anxiety, inflammation. It helps with cellular support. It really helps me to take away migraines to put a drop of copaiba under my tongue. I will also use them on the roof of my mouth. So I'll take my frankincense and put a drop on my thumb and put it on the roof of my mouth. Now, I know we're talking about oils for babies and stuff, but like for me, when I would have a migraine, it was really, really hard to care for my babies when I wasn't feeling well. And so I like to really focus on both. So those are some of the ways that you can use them internally. And then how are we on time, Kirsten? I have like 2 more slides. Is it okay? I know we're over a little bit. Okay. So these are some of the top uses for babies that I hear about. Tummy issues or colic. Maybe baby is fussy, but oftentimes they're fussy because their stomach is upset, and it's the only way they can communicate with you about it, right? Esther, the essential oil for migraines, I use copaiba, Copaiba, under my tongue, and then I use frankincense pushed into the roof of my mouth. The reason I do that in the roof of my mouth rather than under my tongue is because I don't love the flavor of frankincense. So you taste it a little bit less, and it also goes straight into your brain by applying it to the roof of your tongue. Yeah. Oh, and you know what, you guys, I didn't say was the oil that I actually did give internally to my daughter when she was really young was frankincense. And frankincense is a natural expectorant in that it breaks up congestion. And so, you know how us as adults, if we are congested, it's easy for us to like spit something up and get it out. It's not the same case for little ones, right? Their body has to actually break it up and digest it. And so she was so stuffy, and frankincense internally is something that really helps with breaking up that mucus. She was so upset at me, but you love the taste of frankincense. It's grown on me for sure. I still don't love it, but I can handle it, especially because I know how good it is and what it's doing. She didn't know. She was very young. She was nursing, and I just like popped my boob out of her mouth, and like I had a little bit of frankincense on my finger, and I just like stuck that in, and she just, you know, like puckered up and didn't love it. Frankincense, for those of you guys who haven't tried it, Kirsten loves it. It's a very mild, but it's very like resiny. It's very, it's not like it's hot. It's just not a flavor that's probably familiar to you if you've never tried it before. And so she, you know, was nursing exclusively. She was only like 3 months. And so it was definitely a surprise for her. But it worked. And I knew at that point already that this was safe enough that I could actually have my baby ingest it. So that's, you know, ingesting oils for babies. It's not something that I normally do, but it wasn't even a drop. It was just my finger to the top of the oil bottle and getting some and then sticking that in her mouth. But another way that we use them internally, I guess, or is teething. So I talked a bit about congestion already, but these are the top things that I hear about. So I'm going to go across these and just share with you guys what one. So for tummy and colic issues, Digest Zen is our digestive blend. Again, you'll want to dilute it, but you can rub it all over their tummy in a clockwise motion and do a little tummy massage. That really helps a lot. It's something that actually helps with constipation or diarrhea. So you're going to use only one product. You're not like you need all these different products that are going to sit on your shelf and expire, or products that are only for you but not safe for baby, or only for baby and not, you know, that you wouldn't use for anyone in your home. That one bottle of Digest Zen is going to be able to apply to anybody in your family. And so yeah, again, you'd use that on the tummy topically and on the bottoms of the feet. Now the region of the feet that is for the tummy is right in the center of the feet. So you just rub it on there, massage it gently in there, and it really, really helps. Yes, chiropractic care too. We had that issue too. We needed an adjustment. She had like a rib out, and also the digestion really, really, it changed our life. Like my first daughter pretty much just scream cried anytime she wasn't held. And it was a very rude awakening. I had all these visions of like what being a mom was going to be like, and we had this baby that just screamed for the first 2 weeks of life, and I was like, I don't know if I can do this actually. And it was her digestion, and so we figured that out pretty quickly. For congestion, I talked a bit about that. So that's that breathe right there. The frankincense, we did that expectorant. Sleep, so important for baby and for mom. We'll get into that for mom. But so the lavender, I love this. So doTERRA makes pre-diluted roller bottles, and this is the Lavender Touch. Now lavender is safe to use neat, but I always recommend diluting for babies. So this is just a really easy to use. It's already diluted. And then Roman chamomile is my other favorite for sleep. You can mix the two together. Lavender and Roman chamomile is an incredible smell. So you could rub that lavender on your hand and put a drop of Roman chamomile and then rub that all over baby. Frankincense will also help with that. Now teething is also one of the ones where I first got started using oils and was like, wow, that is incredible. So that lavender and that Roman chamomile is also really, really good for teething. You could take a roller bottle and do lavender and a couple drops of Roman chamomile, and you rub that right along the jawline and rub it in there. And that's what you would use on the outside. And then on the actual gums, you could use Siberian fir. Is actually safe to apply neat. Some people dilute it. I didn't. Again, I tried it on myself first. I took a drop of not a drop, a dab. Like I touched it.
There's no meat on the chicken ball. What have after you cook the tattoo, but there's no meat on the chicken ball.
So for teething, so the Siberian fir, again, if you're going to use that on baby's gums, try it on yourself first. So I would take that and test it on my mouth. And when you try the Siberian fir, you'll feel that it's like tingly and a little bit numbing. And it's very, very gentle, but it provides so much relief. So when my daughter would see me coming with that bottle, her arms would start flapping because she was so excited. She knew that it was going to take away that massive pain from teething, right? Another one is that Copaiba, the one that I said I use for my migraines. is also really great for teething, and so that you can actually apply right to the gums as well. And clove is actually what I used when my daughter was teething. Neither of these oils was out yet. But clove, you want to really, really dilute. This is a very, very hot oil. It's incredible for oral care, but it is very, very hot. So this one, you would do 1 drop of the clove in this 10 milliliter size. And so with clean hands, you would take that roller and roll it onto your finger, and then just dab it right onto the part where that tooth is coming up. We had one night where, my husband was in bed with the baby, and they were sleeping. I was up. And all of a sudden, she sat up and was screaming in pain. And he woke up and he's like, I don't know what's going on. Did I roll over her? Like, what is going on? She was about a year at the time. And so he hadn't rolled on her. Her teeth were hurting so bad. So I went and got our blend with our lavender and Roman chamomile for the outside, and the clove one for on top on her actual gums. And in under 5 minutes, she went from like screaming her head off to calm down. She rolled over and fell back asleep, and she started snoring. And he just was sitting there. Like, I went and got the things and put it all over her. And he just was like, that was crazy, to go from screaming her head off to like purring, basically, back asleep, because that pain was taken away that fast. And that was like the moment when I was like, okay, I can't not have these. Like, no mom wants to see her baby in pain, right? So we're gonna wrap up. I'm so sorry we're going overtime. I know you guys have another segment. I had some other ones that we're gonna go over for moms, but I touched on a lot of those. And I am working on a full chorus for Thrive, and that will be coming out hopefully soon. And if you guys don't already have a doTERRA membership, please reach out to me. I know they're going to send out my contact info. If you don't have a membership, please reach out. I'd love to send you some free samples to try out for you and your babies, and to help you create like a more targeted. There's so many options, but really what I like to do is help people get specifically what they need. So thank you, Kirsten.
Thank you, Maile. That was just so much information, and I know you had to really hustle through. So thank you so much for spending that time. We're so excited. Maile's going to be having a part of our course, and is going to be going deep dive into all of the topics she talked about today. So I know we were like anticipating everything she was going to say, but there's going to be so much more in the course that she's doing for us. So we're so stoked. And then, yes, the email that we send later is going to allow you to be able to connect with Maile if you have more questions or anything like that. It's going to send you right to her. So be waiting for that later in your email. So thank you so much, Maile. You're wonderful.
Thank you. Thanks, you guys. Have a great day.
You too. And then now we're going to go ahead and turn it over to Dr. Devonnia Bonimy. She's going to be talking about pelvic floor health, and I'll let her take it away without further ado.
Thanks so much, Kirsten. And I was able to catch the back end of Maile's presentation. So really interesting stuff there. Hello, everybody. I'm Dr. Devonnia Bonimy, physical therapist, a certified lymphedema therapist, a yoga instructor, and I also have my own clinic in the Bahamas called Viva Physio and Wellness. I'm going to take a minute just to set up the screen here, just so we have it. And, okay. And I'm also, of course, a pelvic floor or pelvic health clinical specialist. I got my certification in 2015, and this is a board certification. So I work with both men and women with pelvic floor dysfunction for various reasons. And we'll talk today about what happens in the postpartum period that 4th trimester. And I'm just waiting for Kirsten to turn me, am I a host? So I can put up the screen. Okay, great.
Yep, you should be able to do it. Do you see it?
Great. Okay, give me just 1 minute. Thank you for your patience. There we go. Share screen. Okay. So what we're looking at here, if everyone can see, this is sort of the beginning. Let's go straight through. Hello, so I'm Devonnia. We're going to talk about the anatomy. Where is the pelvic floor? I'm sure most of you are well aware by now. Women's health has sort of taken a huge visibility role in media as well as in the different professions. And the relevance, why are we talking about this today? Common diagnoses in the postpartum period. So the main ones we're going to talk about are perineal pain, urinary incontinence, as well as dyspareunia. So different areas of pain, as well as leaking urine, leaking feces. So this is part of what happens in those first 10 to 14 days and can extend into those first 2 or 3 months. The physical therapy treatment interventions and other risk factors. What are some other things you need to know, and why a pelvic health therapist might be appropriate referral for you from your physician. Okay, so we'll get started with, okay, so in terms of relevance, about 1/4 of women will have a pelvic floor disorder. So that includes urinary leakage, so accidental leakage of urine, fecal incontinence, and pelvic organ prolapse. Pelvic organ prolapse means that one of the organs within your pelvis might be in a position that feels uncomfortable, creating a heaviness. It might be creating some difficulty with emptying, might create difficulty with storage or evacuation for the bowel or bladder area. 10% postpartum women will experience persistent perineal pain. So when we talk about the perineum, we're talking about the space between the vaginal opening and the anus, right? And this can persist for up to 2 months. If it persists for more than 2 months, 2-3 months, then it can develop into something called dyspareunia. But when we talk about perineal pain, this can also be a version of vulvodynia. When we're looking at what happens if you have an assisted delivery, so if you have vacuum assisted delivery, that postpartum perineal pain can increase for more of us, so about 30% of women. And perineal pain can last for up to 18 months, so more than a year, depending on genetics, depending on what you went through, depending on your experience, your birth experience, and also, what happened to those tissues during the delivery process. New moms, so whenever physicians and in that first 6-week postpartum visit, they see their patients, they see the women after they've given birth, they're mostly complaining of heavy bleeding, right? Mostly complaining of exhaustion. I mean, who really gets to sleep in those first few weeks? As well as pain, general pain, within the pelvic area and urinary incontinence. With all of that happening, 1/4 of us are actually expected to go back to work within the first 10 to 40 days. So forget about your 6 months off, forget about 6 weeks off. You're more in that sort of 6-week, 8-week period where you have to go right back to work and be expected to function at your 100%, right? So what used to happen in terms of the village, and I remember the naturopath yesterday talking about this as well, having that village of support, telling you sort of what's going to help you in those first few days. We don't necessarily have the support available. We're going right back to work and expected to function with all of these things happening with our bodies. There's certainly some idea of how can we redirect and how can we get the source of support back to women again. So we'll go on to the next slide. Feel free to ask questions throughout. It's a fairly short presentation and I'm kind of open to having questions during instead of waiting until the very end, but I'll try and time it either way. When we talk about pelvic floor anatomy, we're looking at this image here, and of course you can see the pubic bone. I don't know if you can see my mouse here. Can everyone see the mouse or the cursor? So this is the pubic bone, and then we have the bladder. We have the vaginal canal into the cervix, and then you have the uterus with the fallopian tubes, right? And the ovaries, and then of course the end bit here is your rectum, and here is your tailbone. The pelvic floor actually encompasses from the tailbone, where you have the coccyx, you have coccygeus muscles that run through here, and then you have muscles in the levator ani that come through here as well and attach to the pubic bone. So it really is like a sling or a hammock that is your function of support. It supports all of these organs that are above. It is your ability, or supports your ability to store and evacuate. It is also very functional in your sexual tolerance and sexual ability, sexual function, because you need the pelvic floor to be able to contract completely and relax completely in order to attain an orgasm. So they have an incredible role in overall functioning ability. So it's interesting that sometimes we forget about this part of the woman when we're thinking about the postpartum phase. Really, it's kind of like what's happening with the baby, how's the baby doing, what's happening with the woman, with the baby. But really, women are going through so much in that fourth trimester, that first few months after delivery. And it changes the way you think about your body, how you think about health, and also how doctors treat you when you ask questions about what's going on with your body, and maybe they don't relate, or maybe they're not giving you the answers that you need. So with regards to the pelvis isn't just, the pelvic floor isn't just sort of a sling of musculature. It's not just a hammock. It's actually a dense network of tissue. And it's part of a bigger picture in terms of the musculature and the nerves and the ligaments that are within this part of the body. So the pelvis, starting at those lumbar spine here, 04, 05, and then going into the iliac crest, the bony bits at the top, and then diving down here, that waterfall of musculature, the iliac is going into the psoas, and then deep down into the pelvic floor, this big bowl of muscles that's down here that really helps to support. You can see the yellow lines here are your nerves, right? And you've got layers and layers of nervous tissue. You've got ligaments, there's vascular tissue. There's a lot going on in this area. And it may not just be because of the baby passing through this incredible passageway, but it could be sort of your history of back pain, your history of bowel and bladder dysfunction. It could be the way you're walking. It could be something that happened before you got pregnant, but there are lots of reasons to have pelvic floor dysfunction, which can be worsening during that prenatal and then even into the postpartum period. Okay, so the pelvic floor is down here. The hip would be this region around here. The sacrum is this last bit. So when you look at this area here, S1 through S5. And then the SI joint would be this space on either side. If we were facing, this is of course the pelvis facing us. If you turn this pelvis away from you, the SI joint would be where the sacrum meets the ilium. And that's on the side and the side. And those joints start to move quite a bit during those last few weeks of pregnancy, because you want the baby to be able to maneuver down into that bowl of the pelvis. And then as you go through the laboring process, more and more of that relaxin hormone creates movement and mobility to allow the baby to shimmy down into the canal. And then you have the coccyx, which we talked about way at the bottom, and the pelvic floor is an intricate part of all of that, right? Again, from a bird's eye view, what are we looking at when we talk about the pelvic floor? It's not just one muscle that we squeeze and forget, or squeeze and let go. It's really a dense network of muscles that work together in coordination. And, you know, we have a top half here, and then we have a bottom half here, right? So there's the levator hiatus. This is the vaginal opening, and here we have the rectal opening, the ischial spine here. And then you have sort of the front of the pelvis, which is the pubic symphysis. A lot of times during pregnancy, women will have pain at the pubic joint, where you may have shearing forces, or you may have irritation within this cartilage area here. And that can cause a lot of pain, you know, after week 34, 35, especially as you have a heavier baby going through. And then every time you walk or separate your knees or try and get into and out of bed, you can have a lot of pain in this area, which may not dissipate in the first few weeks after giving birth. And then of course, here's the lumbar spine. So just for orientation, we're looking down at the pelvis. This is the front of the pelvis, this is the back of the pelvis, the lumbar spine, and here's the tailbone. And just kind of take a look at how intricately the pelvic floor weaves through that entire bowl of surface, okay? So in terms of perineal pain, what are we talking about? One of the first diagnoses we talk about, we're looking at the vagina as your gynecologist would look at it, right? So you're sitting on the table. Everyone hates this lithotomy position. Like, I don't have to be in this position. I hope men get to be in this position at some point. But when we look at this image, we're looking at the pudendal nerve and how it branches into 3 different sections, right? So the pudendal nerve branches up top here, the dorsal clitoral. So if you're having difficulty with sensation, with orgasm, with arousal, it could be that there's been some interruption of what's happening through this clitoral nerve here. The pudendal nerve also branches off into the perineal branches. So if you're losing sensation, or if you're hypersensitive, or if you're noticing that even just the slightest touch, wearing cotton underwear, anything can be very uncomfortable, there might be something going on with the nerve branch here. And then of course, when it comes to the anal or inferior rectal nervous tissue here, that's where the branch comes off. So the pudendal nerve has a lot to answer for when we talk about pelvic pain. And remember that when you're giving birth, or even during that entire last trimester, the third trimester, where you have all of that extra weight from the baby, it's pressing down on all the nerves that you saw earlier in the slide. So all those yellow lines that you saw going through, they're being affected, they're being compressed, and there's going to be some effect with regards to where these nerves are traveling throughout the body, and how it manifests within you in terms of sensory function, motor function, and the ability to feel and move and contract and relax. When we talk about perineal pain, so that's space between the vaginal opening and the rectal opening, this area right here, I mean, that's sort of the ring of fire zone that women talk about. It's like, this is what you feel just when you're about to deliver. You're like, oh my gosh, am I able to tolerate this? And sometimes the obstetrician is going to give you an episiotomy. Luckily, in the last decade, it's not been the case. It's not been as common, but that used to be sort of a regular occurrence, in that they would intentionally cut here or tear here for you to allow for an easier passageway for the baby. What we've learned in the last decade or so is that by doing this mechanical tear, it actually ruins the ability of the pelvic floor to contract properly. And when, of course, sometimes when the doctors sewed the women back up, they thought they were helping couples by increasing contractility or making the hole smaller, right, to allow for better sexual function. But in a lot of times it ruined the sensation for most women. It created a lot of issues in terms of pelvic pain long-term. And in terms of storage and evacuation, it also created some difficulty, because as the woman is recovering, you're now dealing with sutures, you're dealing with uneven muscle function. The muscles aren't able to contract the way they're supposed to, and there's sort of a layering effect that happens with muscle fibers that's not happening when you have an episiotomy. So if it's possible for you to tear naturally, that's usually the preferred method nowadays, because your body will find a way to heal. Women were meant to do this. So, I mean, our bodies were created to give birth. With that said, not every woman will have a vaginal delivery. So even if you've had a cesarean, you might still notice perineal pain because of that extended period of baby weight on top of that deep pelvic area, right? And as the baby starts to transition lower and lower in those 8th and 9th months, you can still have the same issues that women who are delivering vaginally can have. So try not to think, oh, this is not an issue for me, I'm having a C-section, or I don't really count in this demographic. Yes, you can still have some of these issues. So the perineal pain would be much worse when you think about sitting, walking, defecating, urinating. So in those first few days, you're having a difficult time. And for some women, that pain range really kind of gets to the 8, 9, 10 region. Infant care, every time you breastfeed, every time you pick up the baby, every time you roll, you're feeling the same pain over and over again. And so this can incite a lot of maternal anxiety. It can create depression when you try to communicate your problems with your spouse and your loved ones, or even with your doctor. You may have a difficult time saying, I'm feeling a lot of pain. And they're like, this is normal. This is part of being a new mom. Just grin and bear it. When actually, no, this is a lot more than I can deal with. Or I feel like I've been telling you this for the last couple of months and nothing's happening, nothing's changing. Women, people in general will start to feel like no one's hearing their problems, and that they're exaggerating, that they're making it up in their head after a while. And remember, perineal pain can continue for 3 months, for 6 months, for 12 months, for 18 months. And if every time you go to the doctor that you feel as if you're being brushed to the side and no one starts to believe you, that really interferes with your ability to function every day. When you're going through this traumatic thing every day and no one's hearing that you have this issue. So imagine what it's like when, you have a smaller issue. I think my spaghetti is not salted enough, and how sensitive you might be reacting to when someone's like, well, I think it's too salty. And you're like, well, I have this perception of what I think is going on, but no one's actually listening. And then it's part of your body instead of like something you're creating. It's like, this is your body. And then having no one listen it can be quite dramatic in terms of, also having to care for a baby that is now 100% dependent on you, and your ability to care for someone else, knowing that you can't take care of yourself the way you'd like to. When you talk about the effects and what happens when you have to strain, I remember very clearly in the first week after giving birth, being terrified to have a bowel movement. I remember thinking, this is the last thing I want to do. I'm just going to wait as long as I can. I'm just going to hold off on pooing. I'm going to stop. And when I finally did it, it was like, okay, that's not too bad. It was uncomfortable. It was painful. But, and I had grade 2 tears. I had vaginal stitching done because I had a tear pretty bad in my first child. But, it was just the anxiety leading up to it, because I could tell every time I sat, it was painful, but also having to go. So imagine when you also have this hyperalgesia, or hypersensitivity in this area, in addition to the recovery process, having to go to the bathroom, having to sit, having to talk, being back at work, right? All of these things can make everyday function even more sort of stressful. So vulvodynia is when you have pain anywhere you see in this area, from the mons pubis, where we're looking at the top here, to the perineum, a little bit lower. And if you have external pain, burning sensation, just very sensitive, that's called vulvodynia. When that pain starts to go internal into the vaginal canal, and then you have pain with penetration, that's whether with a finger or with a tampon, or with a examination with your gynecologist, or with sexual penetration, that's called dyspareunia. And so you can have variations of this pain from the perineum, right, which can also turn into muscle spasms and issues if you're not dealing with it earlier. You can have these issues within those first few months leading into the next 12 months. So hopefully getting in touch with what your body's telling you earlier, and being able to communicate that and feel comfortable communicating that with your healthcare professional, that's really important to start the physical therapy referral going. Very rarely will in the postpartum period do women feel comfortable or even feel like physical therapy is accessible to them, because there's so much focus on what's happening with the baby. You had your 6-week follow-up, you're kind of done with us. Let's focus on how the baby's gaining weight. Is the baby breastfeeding? Is the baby this? Is the baby that? And so we kind of forget ourselves. I remember I didn't even have I haven't had my teeth cleaned in like 4 years or something. It's ridiculous. Don't pay attention. you just forget. I haven't had my eyes checked. And let's not talk about me. I'm just going to say this. So it's important that you pay attention to what your body's telling you, especially when it comes to pain, because pain, especially in the psychological reaction to it, will exacerbate over time. So it's important to capture things early and to talk it through and to get as much information and help as you can. So I like this image here because it actually kind of brings home the idea of how much the pelvic floor has to stretch in order to process the giving birth. The giving birth process is a beautiful transition that we all go through, or most of us go through. But you can see, when the pelvic floor is, dilated, there's all this dilation of the cervix. You have the pelvic floor stretching. This is the superficial part of the pelvic floor, and this part is the deep part of the pelvic floor. You can see how much that stretching occurs for the baby to be able to leave the mother's body, in addition to all of that movement that happens here through the pubic symphysis, and then everything that happens along the tailbone as well. It's going to have to extend, and the ligaments will have to stretch. There's a lot of transitioning happening in the woman's body, depending on how long you're in this position, right? So you might be laboring for several hours. And for some women, it might be just a few minutes. It varies person to person. And so your experience afterwards in the 4th trimester is also going to vary person to person. For the next diagnosis, we're talking about urinary incontinence, and very specifically stress incontinence. So when we talk about overflow incontinence, that's more so because of a urethral blockage. There might be something happening in that the urethra right through here has difficulty with opening and closing, or there's a blockage through there for whatever reason. Stress incontinence is more so when you have an external pressure that's pressing down on the bladder. For example, when you cough, when you laugh, when you sneeze, those are all external pressure that's coming from the thoracic cavity. down onto those pelvic organs. And of course, the bladder is one of those pelvic organs. And if you don't have the strength within the urethral sphincter here, and you don't have the strength with your pelvic floor here, you're going to have some leakage. That's called stress urinary incontinence, which is very specific to if your muscles have just gone through what you just saw, they're not going to have an easy time coming back together. So usually stress incontinence is one of the main diagnoses following giving birth. But if you had a weaker pelvic floor during your pregnancy and also before your pregnancy for whatever reason, maybe you have a history of a chronic cough, maybe you have poor habits when it comes to having a bowel movement and that you're straining regularly because you're constipated prior to being pregnant, because that creates more difficulty in function with the pelvic floor. Or, you may have some genetic disposition that causes more laxity and that you just don't have the ability to use your contractile muscles. Or maybe when you were younger, you didn't really connect with your body, or for whatever reason. If you have sort of different genetic influences, it can be a reason as to why you have this continued stress incontinence when other women are seemingly fine 3 months afterwards, but you're still dealing with leakage and leakage and leakage. In terms of urge incontinence, this is a bladder oversensitivity. It could be from infection. It could be a neurologic disorder. It could also be your diet, right? It could be caffeine. It could be the key and door syndrome. When you get home and your key gets into the lock and all of a sudden you can't stop yourself from having to go to the bathroom so strong. That's urge incontinence, and that there might be certain triggers that are causing the bladder to spasm and then cause squeezing out of urine. So again, typically, depending on what you were doing before your pregnancy, you may have all three of these types of incontinence, or it may just be the stress urinary incontinence. But incontinence is certainly one of the reasons, one of the diagnoses that follows in the postpartum period. And, based on the information I gave before, you can see why. Other clinical manifestations. So when you have muscles within your pelvic floor that are already kind of overactive, they're also called hypertonic. Muscles that are, they don't have the great ability to relax easily. You can have sort of this over sort of active response to muscle spasm or muscle tightening. And this can cause pain in different areas of the body that you may not have expected. So taking it to another part of your body, if you have neck pain because you're at the computer and your head's always forward, right? And the muscles in the back of your neck are spasming because they're working too hard all the time. Over time, you're going to end up having pain behind your eyes. You'll have a referred pain pattern in the forehead and the head. You may have headaches regularly because of this postural change that's causing stress within your muscles of your neck. Same thing happens with the muscles in any part of your body, and specifically now with the pelvic floor. If you're having muscles that are constantly guarded because you have perineal pain, for example, if you have pain within that part of the region and your pelvic floor is reacting to guard you from having pain. So every time you sit, you're like, I'm just going to hold before I sit, or just before I go, I'm going to hold, or when I'm walking, I don't feel comfortable, so I'm going to hold. All of these things can create sort of more activity than needed in terms of the function of the pelvic floor. And as a result, you can have sort of this muscle spasm of the levator ani. And so you see this part here where it's showing like red dots. That's just a referred pain pattern, the trigger points that can happen within the groin because of muscles within the pelvic floor. So you may not notice certain symptoms, but you may just say, I just notice pain all the time in my groin. I'm not sure where it's coming from. It could be a different manifestation as a result of having chronic pelvic pain within the pelvic floor. And as a result, you may have difficulty being able to contract, which confuses some people in that, well, if my muscles are already tight or they're overactive, why can't they contract? Again, there's a layering of what happens with muscle fiber, muscle tissue, in that they have to be able to layer in a certain way and also release in a certain way. And so you may be at this sort of very short level in terms of how the muscle is able to contract, and then you don't have the ability to relax all the way. So that ability to contract and relax may also cause difficulty with some other issues, some other areas of function. You can have coordination dysfunction. So when it comes to having a bowel movement, if you're not able to relax your pelvic floor completely, you're going to feel like you have to strain in order to evacuate. And so bowel and bladder dysfunction becomes part of that, that algorithm, things that are kind of compiling as the woman's going through that first year in the postpartum period. So it can kind of become this compound interest of issues that the woman then has to explain to her doctor, who may or may not be listening to her. And a physical therapy referral might be more appropriate to handle that and to give the woman time to address the issues that she's going through. So what does physical therapy include when we talk about these things here? When you get a referral for pelvic or perineal pain, it might include digital massage, so massage within the pelvic floor region, at the perineum, depending on what's appropriate. And if you're in your week 35, week 34, 35, you may already have started your perineal massage, right? Doing that massage that kind of presses down and around the perineum to help relax the pelvic floor and get your body ready for that deep stretch that happens in the labor period. Manual therapy for different parts of muscles within the pelvis. Biofeedback is a way to teach patients how to properly do pelvic floor contractions and also to learn to properly relax their pelvic floor, because Kegels are not for everyone. And I think that tends to be sort of the overwhelming reaction is, oh, why don't you just do your Kegels? Sorry, I lost my page for a second. Just do your Kegels. Isn't a physical therapist for pelvic health just for Kegels? No, we don't teach Kegels all the time. We do lots of other stuff. And to be honest, Kegels may not be appropriate for you, right? If you have these muscles that are tense and overreactive, the last thing you want to do is tighten it even more, right? You may have to learn how to do different types of exercises to allow for a better function, for that full contraction and full relaxation. Again, for sexual health. Neuromuscular reeducation could be about the way you hold your pelvis or how you're walking or how you coordinate different movements, because you need to be able to coordinate different muscle contractions when you do different activities. So if you want to get back into playing soccer or if you want to go back into jogging and you already have an SI joint dysfunction that's creating muscle imbalance and joint pain when you're jogging, the last thing you want to do is create the same sort of pattern that's creating impact in the joint, which creates pain, which then creates into a cyclical issue with a pain cycle. Behavioral modification and therapeutic activity, that's all about not necessarily nutrition, but getting an idea and monitoring what you're putting into your body and how and when it comes out. A lot of times we don't notice that we've only had a glass of water for the whole day. We're like, well, it's a little bit cold outside, so I think I'll have a hot chocolate. And then maybe I'll have a coffee. Well, I don't know, I kind of like sake. I feel like a glass of wine right now. Maybe I could just have a hot chocolate again. And then you don't realize that by the end of the day, you've had all these different things that could irritate your bladder that are then causing some of the issues that you're having with pelvic floor dysfunction in terms of emptying and storage, right? So there's that urge incontinence again where the bladder starts to spasm, and it could be as simple as changing some of your behaviors. And then of course, patient education is part of the key, because the more you understand what's going on with your body, the easier it is for you to make modifications yourself and to kind of fine tune what's happening in your daily routine, paying attention to what really relaxes you, what is self-care, what feeds you internally, right? What creates that mental de-stress for you, and understanding that not everyone's environment is the same. How can I make my environment so it works for me and my baby in these first few months? In terms of risk factors and other things that you should be concerned about when it comes to pelvic health, prolapse. So pelvic organ prolapse, I touched on a little bit earlier, in that those different pelvic organs, so you have the bladder, the uterus, and the rectum, when you have a genetic disposition of pelvic organs are sitting a little bit lower or in a different position, maybe the bladder has collapsed or fallen or tilted forward or back. Maybe you have a history of constipation. Maybe genetically you have ligaments that don't support those pelvic organs, and so as a result they start to kind of veer downward towards the feet. When you start adding in jogging, going back to exercise or activity too soon, in addition to having the relaxin hormone being released still in your body in those first 4 to 6 months after giving birth, you're putting yourself at increased risk of having a prolapse, right? So prolapse means that one of those organs might be transitioning a little bit further down, and some of those symptoms you may have may be heaviness or pulling down within that area, stress incontinence, again, because the bladder would be a lot lower. You can also have significant constipation, or you're noticing that when you do go, as a result, you feel like you're pushing, you really have to go, but nothing's coming out. And that could be because the rectum is in a place it's not supposed to be, or maybe it's backing up in an area it's not supposed to. But chronic straining creates some of these issues as well with regards to prolapse. When you return to sport or return to running too soon after giving birth, what happens is that you're now putting your body in this increased risk of having the pelvic organs sinking further and further down. So it's important, and the exercise physiologist talked about this yesterday, understanding that your body has to take time to recover, and also understanding what your body is doing while it recovers, taking time to transition through easier exercises before you get to the standing and upright exercises. But prolapse is one of those issues that you don't notice in the beginning, but I will get referrals for prolapse 2-3 years after women have given birth, even up to 20 years later, and the women will say, I wish someone had told me a little bit about this when I gave birth. I wouldn't have gone for so many runs so soon, or I would have rested a little bit more. I would have given myself time to recover. A lot of us feel that we can be super women where we're, back to work in 6 weeks, or we're carrying and lifting everything, or we're going to be cooking the whole time because there's nothing else to do, or we're going to start laundry a week earlier. Give yourself the full 12 weeks to really relax and let your body recover from the inside out. And hopefully you start your pelvic floor exercises, whichever ones are more appropriate for you, earlier in that postpartum phase, so that your body has time to recover more appropriately and things are back in position. So we're going to very highlight different types of prolapse. This is what normal, quote unquote normal, should look like, in that there's a pubic bone. This is the front, this is the back, pubic bone and the tailbone. Here's the rectum, and there's the anal opening. Here's the uterus, and then down to the vaginal canal, and here's the bladder and the urethra. Remember that you can have temporary incontinence because of UTIs. So you can notice if you have an infection or regular infections within the body, or if you're noticing that you're constantly getting UTIs, it could be because there's a kink in the urethra, because the bladder might be tilted slightly. So that could be a reason for UTIs, if that's a question for anyone. For this one over here, the cystocele, the bladder is now kind of tilted a little bit further back. So imagine kind of how difficult it might be to properly or empty your bladder when you go to the bathroom, like, I'm still going. And then you stand up, you're like, I still have to go again. Sit back down, and then you have to empty again. And that could be because of what's happening with the bladder prolapse. Also, again, if you're straining to empty your bladder, you're not doing it right. If you have to strain for any of these, something is going on that you need to address. When we talk about rectocele, where the rectum has now created sort of an extra pouching here, when you have a bowel movement, instead of it coming down and out here, it might be pouching here, so you feel like you really have to go. And then imagine how difficult it might be to insert a tampon, or to have your annual gynecologic exam, or even sometimes if you're having that bladder cystocele, the cystocele where it tilts back, it's also going to be difficult to properly empty your bladder. So you may notice bladder and bowel issues, and you may not be relating it to your pregnancy because it may be a decade later, but it could be as a result of these prolapse symptoms. And then finally, what happens in some cases when women are encouraged to push as hard as they can in the last phase of giving birth, sometimes it can happen where there's too much force, where the woman is doing something called a Valsalva, where she's holding her breath and bearing down, when ideally you should be breathing as you exhale and release the pelvic floor. If you end up doing a Valsalva, where you're holding your breath and bearing down, not only can you injure your back, right? Because if you're holding your breath and creating as much force as possible, you could herniate a disc. But you're also creating this downward pressure on the uterus where the baby has been, going down and out into the vaginal canal. And as a result, in that healing process, of course, if you're someone who is used to being proactive and wants to get back to work early, and you're standing up and you're cooking and you're lifting and you're moving laundry and you're doing all these things that you're not, ideally you shouldn't be doing in those first couple of months, you can also make this prolapse issue a lot worse, right? And that you're feeling like something's there. Like, I feel something there, I can feel it. But you can't see it. Sometimes if you use a mirror, you can actually see the prolapse happening. You may notice it more in standing rather than laying down. So if you are checking for a prolapse, you do that while you're both laying down, and then stand up and use the mirror standing up, and see how it feels when you just very gently strain. I wouldn't recommend straining in general, but if you want to see what's happening when you have to cough or sneeze, and what happens when you think you're doing your pelvic floor contraction or Kegel, and it's noticeably not closing when you think you're working as hard as you possibly can, you know, these are all sort of ideas and symptoms that you want to talk to, signs that you want to talk to your gynecologist about, and saying, I'm noticing this is happening. I think I should be doing what I'm supposed to be doing, but nothing's really improving the scenario. Vaginal weights are not going to solve your problems. Vaginal weights are a great tool to use, and they have their place in terms of recovery, but it may not be the most appropriate tool for you. So before you go ahead and start inserting things into your vagina and start saying, I'm going to do a bunch of Kegels and see how much I can strengthen, you can try it, but remember that education is so important before you start any exercise program. And exercise is not just, you know, it's a prescription like anything else. You need a prescription, you need someone to guide you through based on what your experience has been giving birth and what your history has been in terms of your activity level and your ability to move and how you move. So what happens when you're diagnosed with a prolapse and you come to physical therapy? Again, very similar things, but it might be associated with weight loss and your aerobic capacity, because obesity is one of the factors as we look into prolapse symptoms, but also improving your body mechanics with lifting. So if you're into CrossFit, if you're into kind of lifting heavier weights, if you're someone who does a lot of lifting and you want to get back into that, some very simple things you can start with in, you know, after that 12-week process, after you've gone through sort of your very basic Kegel program or strengthening program or body awareness program. You start to lift incrementally, if you can lift at all, depending on the staging of your prolapse, and being really aware of what your body's able to do, and controlling each bit step by step. Reducing and controlling a chronic cough. So if you have a history of this coughing issue before, you do want to address that as soon as possible. A vaginal pessary, which is kind of like a diaphragm that they insert into the vaginal canal to support and lift up the uterus, that might be appropriate, especially if you want to avoid surgery. And you may need a referral to other healthcare professionals depending on what's going on with you. Because again, if you're having pelvic pain, if you're having prolapse issues, if you're having lumbar spine issues, if you're also going through issues with breastfeeding, and you notice every time you breastfeed, you're noticing more of the straining, it could be something else going on as well. And it might be more appropriate to address sort of nutrition and other issues with the appropriate healthcare professionals. I mean, that's always an option. In terms of psychotherapy or psychologic support, these are also very appropriate, especially in the postpartum period. And you need to know that there are appropriate healthcare professionals that you should be referred to for additional support, because this is what they do all day, every day. Okay, so I like to add this slide in here because physical therapy has a very interesting relationship with billing. Even cowards can endure hardship, only the brave can endure suspense. A lot of times when it comes to symptoms like chronic pelvic pain, when it's specific to penetration or sexual function, they're not going to be reimbursed by insurance companies. So you want to make sure that whatever your diagnosis is, you have a very clear conversation with your gynecologist and with your physical therapist and say, is this going to be covered, or is this something, or just call your insurance provider and say, here's the diagnosis. And it might be that if you're diagnosed with just dyspareunia, not going to cover it, but if you're diagnosed with dyspareunia in addition to pelvic organ prolapse, in addition to lumbosacral pain, in addition to sacroiliac, then it might be covered. But it's always important to understand kind of what is available to you before you go into, because healthcare costs can be extortionate. And, you know, as healthcare professionals, we want to be very mindful about what our patients are paying for as they go through each session. And if we're referring to different professionals, we want to make sure that patients can actually afford or have options to afford different types of care. So with that said, thank you very much. Again, I thought about giving up. So when you talk about recovery and being a new mom, there's a lot of pressure. There's a lot of anxiety. There's a lot of unknowns. And, you know, everyone's scenario is very different, and how you love and how you care for someone is really personal. So it's important that you never give up. And I remember who was watching, because your children are always watching you and learning from you. But yeah, this is me. Does anybody have any questions?
I saw that there was a couple that were brought up in the chats. I can bring those up first, and then we can open up if other people want to chime in after.
Okay.
Somebody asked, does the size of your babies make a difference in having low back and pelvic floor pain?
Yes, of course. So imagine that you're carrying a bowling ball, right? A bowling ball on top of your head. Your head's the size of a bowling ball, for example. If you carry that weight slightly forward, it changes everything that happens in your neck muscles because of anatomically how you're carrying your body, right? Change that to lower belly. What's happening in the lower abdomen? Your lumbar curvature is going to get significantly more. If your baby is heavier, it may change the way you're holding your pelvis. Either you're anteriorly or posteriorly rotated. It also depends on how you were holding your back muscles before as well. Some of us are very good in terms of postural support, and some of us already had some dysfunction before we got pregnant, and that can create more difficulty as well. Remember that as you progress through the pregnancy, whatever you were going through before usually will continue as well, and your ligaments are really what's holding you together. And so as they continue to stretch and as the weight comes down into the pelvic floor, it all has a cumulative effect in your ability to function. But again, women were made for this. It's just that because we've now transitioned into the sort of office mode and drive to work, sit at work, drive home, watch TV at home, we're not using our bodies the way we used to, right? So the fact that we're not in the active zone that we used to be, you know, being out in the fields, being out on the beach, playing more active roles in recreational lifestyle, because we're not in that zone anymore. We don't have the village around us to remind us, you know, take a break, take care of yourself. You know, here's what I used to do. Use a lumbar support. Here's a sacroiliac belt. Like there's different ways that women really used to take care of each other. And because we've lost so many things and we've created new problems for ourselves, yes, obesity, a heavier baby, the way you hold yourself, all those have a huge influence on what's happening with the pelvic floor as well. Yes.
Awesome. And then there was another one that said, I had a natural tear, fairly minor, and was stitched up with only 2 stitches. I've been having a little pain after about a month or so. Is it likely the scar tissue from the stitches or the muscles itself?
So when you have stitches and you're going, when it comes to different, how your body heals from stitches, and that's for a stitch in your arm, stitch in anywhere in your body, you will develop scar tissue, and then you also have connective tissue on top of that. So hydration is also very important in addition to mobilizing the scar. If you're able to very, very gently do sort of skin rolling along the scar, work the scar tissue, that could be a reason as to why you're having some of the pain. But remember that slide that talked about the pudendal nerve? The nerves are traveling through different parts of the genitalia. So if that scar tissue, or if you're in the process of healing, it's caught on the nerve, that could be a reason why you're also having nerve pain, right? Nerve pain usually is burning, shooting pain, hot pain, and you can have some of those symptoms specific to dyspareunia because of that. So it depends. It's been about a month. So I would definitely say have a conversation again with your physician and say, I'm taking pain medication, I've done my skin massage, I've done some rolling, I've noticed that with my essential oils or the oils that I use for my body, I can do a little bit more, but I'm still noticing a lot of pain. What else could be going on?
Awesome. And then the last one that was typed in the chats was, how can we find a good pelvic floor therapist locally, or do you do anything virtually?
So if you're in America, the apta.org, and you can go to Academy, I'll just put it in the group, Academy of Pelvic Health. They have a site where you just put in your zip code and they will tell you which therapists are in your area. I have fought to be properly on this list because they kept putting me in Florida, and I'm like, I'm not in Florida, I'm in the Bahamas. But you can find me if you go through that as well. And the email address is on there, the website's on there. So whoever's in your area, whether you be in Seattle, I think it's mostly United States. I want to say Canada, but I don't think it's Canada. If you're in Seattle or if you're in Florida, there's a therapist near you, I guarantee you. Maybe not 2 miles away, maybe like 50 miles away, depending on, where you are in the city or in that country. But it's a really great resource to find someone who is appropriate, and they'll also list sort of what their specialty is. So for me, they'll have pelvic floor dysfunction, bowel dysfunction, lymphedema management. I don't work with children. I don't do pediatric pelvic floor health, but that's one of the options as well. Chronic pelvic pain is one of them as well. And there's like a list of 12 other things. So, you can scroll through the list and see if that person that you found in the list actually does the thing that you want them to work on. And if anything else, you just give them a call and you talk through your issues over the phone with them. and you find out, what's appropriate for you. But of course, virtual telehealth is available and is being reimbursed in the United States. Unfortunately, it is not reimbursed in the Bahamas. So if you want a virtual session, you'll have to pay full cost with me.
Awesome. And the exciting thing is, though, Devonnia is amazing and is going to be looking over a lot of the content that we have in our How to Thrive Postpartum course, because it's very basic right now. So she's going to be looking it over and just making a lot more in-depth, a lot more accurate. So that will be coming out soon too, which is exciting. But thank you so much for being able to connect us so everyone can find a pelvic floor health specialist locally. A lot of us were chatting in the chat too, like just seeing those pictures and how like prolapse works is like, oh, wait, I think I might have prolapse going on. And like, it helps. It was like so helpful to see it and then understand a little more.
There are different grades to prolapse. You could be a grade 1, right?
Mm-hmm.
And there could be a very easy program for you just to kind of be aware of what you're doing. When you lift, make sure you're not holding your breath, or make sure that you're using good body mechanics. Make sure you're using appropriate, lifting techniques. And then the prolapse may not be an issue. But then there's stage 2, stage 3 prolapse where you might be more appropriate for surgery, right? Or you've had this issue for so long it's not been addressed. So it's important, again, prevention is so important. And that's the key for any physical therapy sort of mantra, is that the earlier you get in with whatever your issue may be, the easier it is to prevent the issue of surgery and the things that happen afterwards.
So that's everybody's homework, is to either one, like with Devonnia, or to find a local pelvic floor health specialist, because I'm sure all of us probably need it no matter what degree we're in. So thank you so much for your presentation. This was so eye-opening. For everybody who has attended or has more questions for the speakers, an email is going to be going out that will connect you with both of them. Their links to their websites and their contact information is going to be in there. And yes, we did it. We went way over, but why not?
Oh, sorry.
Right? No, we all were like sitting on the edge of our seats with Maile and with you as well. So it's important information. And I'm just so thankful that everybody came, and I hope everyone has a great rest of their day. One thing I did want to mention is that for those who wanted to be involved in the giveaway, we're giving away one free course to a mama. If you type here in the chat, that helps me to keep track of who is attending and who can be eligible for the giveaway. Woohoo, yeah, Bree. She's like, I'm getting mine. So, but other than that, I'll sit here for a little bit longer in the chats if everybody hops off, and then we'll go ahead and end this call and see you tomorrow.
Thanks so much.
Thank you.